Welcome back. So we talked about the characteristics of the critical thinker, and you practice thinking. You think about what you think, and we think sometimes a long time before we take action, and sometimes a short time. You ask yourself, how long is this going to take? How much do I need? How much help do I need? How much effort will it take? Sometimes we need help when we think. As we move through this, we start to transform the knowledge. We start to change or convert the way that we look at concepts because we start to look at the nature, form, the function of those concepts along with the context or within the context. That's where our clinical reasoning starts to occur. So what is clinical reasoning? Well, clinical reasoning is the process that we use in the clinical setting to evaluate and then select which of the actions we'll take to meet the desired goal, to help our patient reach the best possible outcome. So we've used our critical thinking, we've used our intuition, and we make the sort of decisions that are important decisions. Why are they important? Why is clinical reasoning important? Because it helps us make decisions like, how do I prioritize? Which patient do I need to take care of first? Which patient can wait? How long should I wait before doing a particular procedure? What's the best process for me to use to help my patient? How can I plan my day where I can accomplish all of the care that I need to provide to my patient, along with getting to that meeting that my manager has required I attend? So when we look at why clinical reasoning is important, we learn it's a prioritization. It's the way that we fit in the things that we're going to do. We have to think about the decisions that we make in terms of their value. Time management is important to us, as well as prioritizing. So when we look at clinical reasoning, we have to think about what are the differences between this clinical reasoning, critical thinking, and clinical judgment. As we look at this clinical reasoning cycle, you're going to see it looks very similar to our nursing process. We gather information or collect data. We process that information. We identify any problems or issues with it and establish goals. Then we take action and evaluate the outcome of that action, reflecting on the process and is there anything that we have learned in doing this process or this procedure or whatever it is that we've done for this patient. And we consider the patient's situation, collect more cues, and start all over again. So problem solving is the norm for our nursing responsibilities. We become skilled problem solvers, which is why you'll often hear me say that nursing is a lifestyle choice as opposed to a profession or a career, because we start to think in terms of problem solving and our world changes as a result of it. Our worldview changes as a result of it. So speaking about our worldview, you're going to leave our program as a novice nurse. Practice makes perfect. What makes me say that? Well, research has shown that it takes about 10,000 hours to become an expert at something like chess. Perhaps you've heard of the famous Bobby Fischer, right? I am one of those people that will tell you that he is the greatest chess player ever. There are others who may tell you that it's Magnus Carlsen. But to become a chess expert takes at least 10,000 hours of practice. Consider playing a musical instrument. Eben George plays 27 musical instruments. He could play 27 of them by the age of 23. He started playing his first musical instruments at age 2. 10,000 hours to become an expert musician. Consider woodworking. Norm Abram, you might recognize him from his work as the famous carpenter on the PBS television program This Old House or the New Yankee Workshop. He's what we would consider an expert, a master carpenter. When we're looking at a profession, such as medicine or nursing, it takes about 10 years of deliberate practice to become an expert. So to become a diagnostician, like a physician, to become an expert nurse, to become an actuary, where you look at risk management, you look at the associations between asset management and liability management and make a valuation. That's a skill, just like the skill of a therapist. Takes about 10 years of very deliberate practice to become an expert. We will go on to become expert nurses. We will start to recognize bias in research, bias in our own practice and our own thought processes, bias in others. One of the things that we cannot do is predict errors in others or of others. But we can learn to mitigate errors in our own practice through our critical thinking and our creative thinking that helps us develop our clinical decision making and clinical judgment. So where do we start? How does this work? Well, you're going to leave the college with some wonderful knowledge, but then every measure of knowledge and performance will start to decay right after graduation. You will hear your faculty say, as soon as you graduate, go take your state boards. That's because we know that the greatest success potential is going to occur as soon as you can possibly take it after you graduate. Now, that being said, you're thinking, oh, I'm going to start as a novice. You tell me I'm going to be an expert, but this doesn't sound like I'm going to be an expert because I'm just going to graduate and all the knowledge and performance that I have developed is going to start to decay. Well, there's some good news, and that is that you will still have your early clinical reasoning skills. You'll be able to use the problem-solving skills that you have learned to search for general problems. You will look at these problems from a very content-specific perspective and understand that knowledge will play a central role in what you're doing. So it's very important. It seems redundant to you that we go over and over certain things in nursing school. But the reason that we're doing that is because we know that this knowledge base that you have is the foundation. It's fundamental to everything that you're going to do. As you move through, the concepts that we're teaching you in this concept-based curriculum will creep in more often. You'll start to realize the hierarchical networks that occur. You will start to understand the propositions, the what ifs, and the probabilities, and you'll look back on the exemplars, those things that you can look at and say, I remember when I had a patient who did such and such a thing. And you'll be able to take that exemplar, reflect on it, and relate it to the patient that you're taking care of at that point. So as these concepts continue to creep in, you'll develop these roles of the exemplars. You'll start to categorize them. You will see the role of the exemplar will come forward with these concepts connecting to specific experiences that you will have in dealing with patients. The exemplars are always going to be connected to physiology because as nurses, we take care of sick people, right? We take care of those who have disease and the human response to that disease. We will also keep those exemplars connected to the basic sciences because we will search for patterns and we'll use analysis as well as predictions. So in the course of becoming an expert, you will have this extensive stable of exemplars that will help guide you in managing your new problems. You'll do that from an analytical or a rule-based role or perspective, or a holistic or a similarity-based perspective. You may not realize the role of exemplars in your life, but you have been doing this your entire life. For example, we recognize everyday objects. The process is effortless. We don't even think about it. Let's just take, for example, a door. The door to the garage, the door to the bathroom, and the door to your car are all doors, but they look very different. The garage door lifts from the bottom. It may be a huge door, double car garage or two-car garage. It may be electric, it may have a motor on it. The door to your bathroom probably is not as wide, maybe, as another door. It has a doorknob on it. It opens one way, not swinging both ways. The door to your car opens one way. It has a totally different kind of handle on it. But you recognize those everyday objects, the door, as a door. You're not even aware that you have elicited or weighted the individual features of those doors. But when I say car door, garage door, and bathroom door, you know what I'm talking about. Those are all exemplars of the concept of door. What if I said the door to another world? You would maybe visualize that in a very different way depending on your experience with doors. So this process appears to occur all at once, but really it's been very gradual in coming. And you are able to use this in the nursing process and in your nursing world as you go through clinical reasoning. We can know that it's based on these relationships with an accumulation of examples, or what we call exemplars. Those exemplars help us with our hypotheses. I know I can go through the door. These examples aid us in interpreting ambiguous data. I don't know what a door to another world looks like, but if I encounter an opening or a door to another world, when I see it, I will know it. So this is how we use these exemplars and this critical thinking to be able to make good, sound clinical judgment and clinical reasoning. And we'll use both that intuition as well as the analytical facts to move forward with evidence-based practice to provide good care for great outcomes for our patients. If you have questions, please feel free to contact me. You know how to get a hold of me. We're here to help you. I'll look forward to seeing you soon. Take care.